The holidays didn't help. Just this morning, there are new concerns and confusion over Obamacare. Good morning. Thanks for joining us. We hope you had a wonderful Christmas off. I'm Leland Vittert, sitting in today for John Scott.
And I'm Harris Faulkner. I'm here for my friend Jenna Lee. A lot of last-minute changes to the health care law. And now new questions about whether people who've signed up will even have coverage on January 1st. The deadline to do that already changing several times this week. Even after Tuesday night's cutoff, the Obama administration announced people who ran into more technical difficulties with the website could still get covered by New Year's Day. But signing up isn't enough. There's a premium to pay to lock in coverage, and the deadline to do that is different all over the nation, depending on where you live. Chief White House correspondent Ed Henry is live in Washington. So maybe you can cut through the confusion for us now, Ed.
Well, Harris, good to see you and Merry Christmas. The bottom line is that administration officials say that they're not extending the deadline for anyone who's starting fresh today or tomorrow. Instead, as you suggested, it's for people who are already in the queue, were trying to get in by the end of Christmas Eve deadline, might be stuck in there somewhere in cyberspace. They want to give them a little more flexibility so that they actually have insurance on January 1st. The real question, though, is going to be of these people who either are still in queue right now or had been in the line before even Christmas Eve because of delays on the website, et cetera. Are they now going to have insurance on January 1st after doing all the right thing, filling out all the right paperwork, et cetera? In terms of extending these deadlines, a spokeswoman at CMS telling us here's why, quote, our highest priority is making sure that everyone who wants to enroll to have health care coverage by January 1st is able to do so, particularly since consumers had a hard time accessing healthcare.gov in October and November. Now, there are a lot of Republicans on Capitol Hill, though, who are saying that if there continue to be these problems, it's going to provide an opening for Congress, which has the power of the purse, to make sure there's much more dramatic change to this law when Congress comes back to work in the next week or so. Here's Jerry Moran from Kansas.
We need to do things to improve health care in our country. The Affordable Care Act is not the way to do it. But for us to determine where to go from here, one would think, particularly when they're spending taxpayer dollars, that Congress would have something to say about it.
Now, the president's also going to have something to say about this when he gets back from Hawaii. Remember, at the end of January, he's got his State of the Union address. We anticipate from talking to top officials that obviously implementation of health care will be a very big part of that speech. But the bottom line is Republicans have been previously frustrated in their efforts to either repeal the law or come up with dramatic change. The key in January, February is going to be whether there are Democrats who are up for election in 2014 feeling the heat over this health care law who may finally join Republicans in pushing for major changes. That's why this January 1st deadline is very important, not just for the people trying to get health care, that's important, but also, is there going to be change? If there's another stumble, that's going to give the critics impetus to have some major change, Harris.
Well, and those politicians, too, will be tossing it around about 1/6 of our economy because that's what this thing costs. Ed Henry, good to see you. Thank you.
Good to see you.